Hi, this is Dr. Centeno, and I'd like to talk to you today in a short video about our fellowship programs in interventional orthopedics. Interventional orthopedics is really a seed change in medicine, and the focus here is using biologics to fix or help various areas of the musculoskeletal system. And more precisely, it's being able to place biologics like stem cells into any part of the musculoskeletal system. And what do I mean by that? Placing cells from the C0, C1 facet joint into an L5S1 disc or into the tibio-talar joint of the ankle or into the ligaments that support the carpal bones or into the talofibular ligament, etc. So again, all over the human musculoskeletal system under precise guidance. Regenexx is a national network of advanced interventional orthopedic practitioners that use a flexible lab platform to deploy most advanced and up-to-date biologics technologies available. And a flexible lab platform is a mini lab that can process FDA-compliant biologics in whatever formulation proves to have the best efficacy. And it's really agnostic to what that is, meaning at the end of the day, if a certain stem cell formulation shows that it's the best, then we will produce it. If another cytokine formulation shows it's the best, as long as that's FDA compliant, we will produce it. In addition, it's a lab research effort and a clinical registry to continuously define what works the best. Because right now in this young field, we need that kind of innovation and we need that kind of attention to detail and outcomes to really decide how best to treat patients with a specific indication or problem. And interventional orthopedics differs from other fields in that it's much less invasive than surgical orthopedics. And it combines the peripheral joint knowledge of sports medicine with the advanced spine injection skills of an interventional spine practitioner. It uses both ultrasound and fluoroscopy, and its treatment focus is on regenerative medicine. We offer two different fellowship programs, a one-year full fellowship program with a lab and or clinical research component, very similar to a traditional fellowship, and a 3-month mini fellowship. Both programs are located at our state-of-the-art facility in Broomfield, Colorado. We started doing this work with stem cells a decade ago, and we're the first practitioners in the U.S. to do so. So we have a lot of experience with this type of treatment. We have, as part of the lab, a very unique CGMP class clean room that processes cells for same-day use. We also have a separate university-style stem cell research facility staffed with a PhD-led research team and a clinical registry with a biostats team tracking thousands of treated patients. So this is not your average medical office by any stretch of the imagination. And the base qualifications for both programs, physical medicine rehab or primary care sports. If it's primary care sports, the candidate has to have at least 100 proctored lumbar cases completed by the time of the fellowship commencement. In the one-year full fellowship, for the first 6 months, it's half-time clinical and half-time research. For the second 6 months, it's 3/4 time clinical and 1/4 time research. And the perfect candidate is a PM&R residency graduate who has gotten some experience in musculoskeletal ultrasound and lumbar fluoroscopically guided procedures, but they're really looking for much higher level training in advanced procedural care using both musculoskeletal ultrasound and fluoroscopy. So really both sports medicine and advanced spine with a focus on regenerative medicine. So a focus not on the past of injecting steroids, but on the future. In our 3-month mini fellowship, these begin once a quarter. It's full-time clinical. There's not a research component. And it's important to note that applicants are essentially being interviewed and hired for a full-time position within the Regenexx network. Hence, this is a mini fellowship that comes with a job, a very unique concept. And a perfect candidate is someone who's a bit more advanced. They've been through a fellowship program and they want to hone those skills in regenerative medicine and or add a skill set they don't have. Let's say the applicant has been through a fellowship program in interventional spine and wants to add musculoskeletal ultrasound of joints, or vice versa. So for more information, here's my email address. You can contact me directly. We would love to talk to you about these great programs. They're very unique. There are very few high-level educational opportunities in interventional spine and sports together. In addition to that, very, very few that are heavily focused on regenerative medicine. So I look forward to hearing from you.